Thank you.
Okay.
And it's time to start the international session. Today is the 1086th day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. Before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1086th day of the uninterrupted daily webinar of Ifph. And today, our guest is Dr. NIKUNJ M. TRIVEDI. Dr. NIKUNJ specializes in treating fertility problems and chronic diseases and has authored 4 books on the subject. He received his degree with a gold medal in homeopathy in 1980 from India and has 43 years of versatile clinical experience. He obtained further training in medicine, gynecology, and surgery and started his own private practice. He is a fellow of the British Institute of Homeopathy and a fellow of Royal Society of Health. He has been awarded as Man of Achievement in 2002. He is affiliated with many homeopathic organizations around the world. Dr. NIKUNJ is a board member of Homeopathy for Children Charity, UK. He had been honorary lecturer in the Department of Clinical Therapeutics at Homeopathic Medical College, and he teaches homeopathy. Dr. NIKUNJ has published many articles and research papers and conducted many seminars and lectures in the field of infertility and homeopathy. He has treated more than 2 lakh patients in his 43 years of clinical career, which includes infertility and chronic diseases with dazzling success over India and across the world with his online clinic. Dr. NIKUNJ TRIVEDI began his career as a medically qualified homeopath, ranked first in university, and has been practicing homeopathy since 1980 in India and from 2004 in the UK. Dr. NIKUNJ is a life member of the Homeopathic Medical Association of India and DHMA India. He is currently servicing as a chairman of UK HMA. Dr. NIKUNJ has held several charity clinics and regularly participates in the Homeopathic Awareness Week. He also runs sitting-in clinics and clinical training sessions for students and homeopaths. Let's welcome our speaker, Dr. NIKUNJ M. TRIVEDI, and I welcome all for the session. And today's subject is respiratory disorders and homeopathy.
Thank you, Dr. Binduraj. Greetings to everyone. And today's 1086th day of uninterrupted flow of Ifph webinar. Yes, today I am going to talk on the respiratory disorder and homeopathy, pulmonary disorder and homeopathy, and how our homeopathy can be correlated with modern medical science, and how our repertorization takes U-turn while treating the patients with the cheap complaint on miasmatic ground, how it takes a U-turn. That's very, very important. See, every day we are coming across loads and loads of patients with a different type of clinical conditions. And you must have come across many patients with a breathlessness, with a asthma. To my knowledge, many of our colleagues, they are specialized in treating the asthmatic patient. And they become asthma specialist. So here, when we treat any patient at that time, every homeopath, not myself, but every homeopath, they must have come across a sort of a dual mind while selecting a remedy. Whether shall I give this remedy to my patient or not? Everyone having this type of confusion. So at that time, we become anacardium patient. And then at that time, we need a jalsamium to boost up our confidence. So today I'm going to share a very interesting case. And recently we had a sort of a free sitting in clinic at my clinic. Various homeopaths, they have attended it. And two homeopaths from our Ifph group, Dr. Rajani and Dr. Veni, they have attended this sitting in clinic, and later on will share their experience with the patient. Okay, so before I start my session, last time I shared my view that listen to your heart. Listen to your intuitions while treating the patient. No doubt repertoire is good, your clinical skill is good, but what your intuitions, what your gut feeling, and what your heart whispers to you, that is very, very important. And here I would like to take an opportunity to share my screen with you. Hope it's visible now.
Yeah. Now it is.
Yeah. I believe success is a journey, not the destination. And Aarti Clinic is entering in 44th year of practice on 24th of August, 2023. I started my career in 1980, and on 24th of August, I'm entering in 44th year of our successful clinical practice. So today our topic is respiratory disorder or pulmonary disorder and homeopathy. Just now, I shared my view that always listen to whisper of your heart. And while listening to the whisper of our heart, how it can change the quality of life of our patient, that I'm going to share today with all my colleagues. And dyspnea on exertion is also associated with cardiac problem, psychological problem, respiratory problem, and neurological problem as well. Okay, but today we are going to discuss pulmonary disease, pulmonary disorder, respiratory disorder, and its homeopathic management. In UK, there are a lot of charities working on different diseases apart from the doctors, apart from the consultant, and one of the charities, Asthma UK. Asthma UK is collecting all the data that how many patients in UK having asthma. So UK having a 12% of population, and in terms of figure, 8 million peoples having complaint of breathlessness, complaint of asthma, real asthma. They have been diagnosed with asthma. About 5.4 million people receiving a treatment for asthma, and the number has been increased after COVID-19. And here I have shown the airways, because all we know about the respiratory system, so I will not go in much detail. But when patient complains about dyspnea or breathlessness, the first diagnosis come to our mind is asthma. We must rule out other causes as well. It's a common long-term disease that requires ongoing treatment and its perfect management. Patients diagnosed with asthma have very sensitive airways. The tubes, the bronchioles, the trachea, bronchioles, alveoli, that becomes very, very sensitive. Sometimes with the chronic condition, they are losing that elasticity as well. And then patient is landing up with the bronchiectasis. One of the leading politicians of UK, his son passed away with the cystic fibrosis. It is also a condition related with the respiration, but we'll talk about it later on at some time. So patient diagnosed with asthma have very sensitive airways. The trachea and bronchi, which carry air in and out our lungs. So that's why it is sensitive airways. And some trigger factor can cause airway becomes inflamed, tightened, and constricted. And that's why it is called the bronchospasm. The bronchus, the bronchioles, the trachea, they're having a fibers, muscle fiber. And when that muscle fiber goes in cramps, it is called the bronchospasm. And our master, Dr. Hahnemann, has developed a sort of a concept of individualization. Every individual is different. Same way, every homeopathy is different, and every homeopathy is a potential homeopathy. There is some hidden potentiality in every homeopathy. Same way, every disease having its own peculiarity. And we have to find that peculiarity, that PQRS symptoms, that modalities along with the chief complaint. So some trigger factors can cause airway to become inflamed, tightened, and constricted, causing a bronchospasm. And these are the trigger factors. Stress is one of the factors where patients become breathless. Fear of exam. Sometimes patient is met up with an accident and patient becomes breathless due to stress, due to fear. Exercise also making a patient to feel breathless. Acclimatization, cold air, cold weather, sudden change in weather, which is right now everywhere. Even India also, there is a sudden change of weather. With the bright sunshine, it suddenly turns into a rainy or cloudy weather. So this type of acclimatization in UK, what happens that we having a radiators to keep our house warm. So when you are in the house, you are warm. But for a second, if you go out, it is freezing cold. Sometimes it is in minus, rarely, but sometimes it is 4 degree, 5 degree, 6 degree, and all of a sudden you go out and your body becomes absolutely cold. So this is a sudden change in your body rhythm, in your body temperature, and that changes in weather is also causing, or it is considered as a precipitating factor for the breathlessness, dyspnea, or it may invite asthma. Smoke. When there is a fireplace in a house, it is causing smoke and patient developing a sort of a breathlessness, asthma. Smoking habits. Drugs, weeds. Smoking of pipe. These are the things. In India, especially those pujari, means those who are priests, they are having a lot of incense stick in the temple. They are also developing a sort of a breathlessness or asthma because of the smoke, because of the atmosphere, because of the pollution, habitat, damp marshy place, high altitude. This is also precipitating for the asthma. Occupation is one of the factor. Pollen, pets, the fur of the pet, certain food ingredients, vaccine, and allergy. These are the trigger factors for the developing a breathlessness or asthma. Let us discuss a case with multidimensional analysis. But before we start with this patient, let me go back to the previous slide. And here I would like to discuss more about on vaccine. Many patients after taking a COVID vaccine, 3 to 4 COVID vaccine patients have taken, and then they develop a asthma, breathlessness. And I'm going to discuss the patient who took the COVID vaccination, and all his complaints started after that. Here, childhood asthma is very common. And with my observation, those infants have taken the vaccine. After a couple of months, after a couple of weeks, they develop a sort of eczema, skin rashes. And later on, they develop asthma. So in our organon of medicine, Dr. Hahnemann has mentioned the double complex disease. One goes and other comes. A weaker dynamic affection is abolished by a stronger one, and stronger dynamic affection then takes the hold of the immune system. So in that case, when I'm treating any infant or any child with a condition of skin eruptions, eczema, they, after a couple of weeks, they develop a sort of a breathlessness. And I explain the parents that it's a good sign that now disease will come under control. So vaccine is one of the factor over here. And because of the vaccine, patients are developing a eczema, asthma. And eczema and asthma, these two diseases are the two sides of the coin. One comes, other goes. While in India, I practiced in India for 25 years, but hardly any infant or any child I have seen with the condition like this. And reason is that is purified protein derivative is one of the factor which is precipitating the asthmatic attack in a children. Now we are coming to the case with a multi-dimensional analysis. A 49-year-old man, he is working in a bakery, local bakery. They are producing all the bakery products like bread, from bread to croissant and everything, with no significant illness, because this gentleman was my patient beforehand for the fertility issue as well. And with my treatment, they're having a baby as well. So long back, I treated him, and he remembered that, oh, Dr. Nikunj is treating chronic condition. So let me try and let me go to him. So he came to my clinic with a condition of shortness of breath, SOB. Then another complaint was SOBOE, that is shortness of breath on exertion. Dyspnea worsening with exertion. He was going to the gym, he was doing gardening, and all the physical activity has been restricted with his breathlessness. So he has an intermittent productive cough with yellow sputum. Sometimes it changes to the green and yellow. And when patient having a yellow and green cough, at that time, we can think about some infection. And before coming to me, he been to the general practitioner. We call here as a GP. GP has prescribed him a course of antibiotics, that was amoxicillin and doxycycline with a bronchodilators liquid, but he was not better with that. He, while taking history, he told me that no associated chest pain, no hemoptysis, means no blood in the sputum, no fever, and no night sweat. He's a non-smoker. He's not taking alcohol, and no any major illness in childhood. So these are the symptoms I found while taking his history. But last year, he had COVID and he took 3 vaccines for it. All his complaints started after taking 3rd dose of COVID vaccine. He visited India and he is from Gujarat and his town's name is Bharuch. And here I would like to draw the attention of all my colleagues that when we were studying at that time, we were also studied the preventive and social medicine. In short form, we call that as a hygiene. We studied hygiene and PCM, PSM, preventive and social medicine. So the knowledge of preventive and social medicine is very, very important. And remember this, he visited India, Gujarat, Bharuch. He took treatment over there, but there was no any relief he obtained, so he came back. And as he's working in a bakery, the health and safety standards are very, very strict, and he has to be vaccinated compulsory. And he was not given any choice that you can't take, he has to take. So he here, after coming back to UK, he was prescribed albuterol inhaler, just like salbutamol. It's a bronchodilator, considering asthma, which showed mild improvement. Temporary bronchodilators has worked and he felt a bit better, but again his symptoms came back. And when symptoms came back, he was in remission only for a certain period of time. But when relapse came, at that time, he developed a shortness of breath, which has gone worst to an extent that he became limited to light activities. He cannot climb the stairs. He cannot do any routine activities around his house. He cannot do any gardening. And then he became restricted to it. Means he was feeling so tired, so weak, so breathless. So he has restricted all his activity. And then he felt like that he has become a sort of a disabled. He couldn't go to gym. He couldn't take his children to the park for the shopping and all. So he was so disappointed with his condition, and I have seen his acute attack. So I can imagine that how difficult was it for him. Associated symptoms. He developed a random itching all over the body. Irrespective of the time, he was started itching everywhere. Severe itching at back passage. Before toilet, he was developing a severe itching at anal region. After passing stool, he was a bit relieved, but after 10, 15, 20 minutes, after half an hour, again he was started the same symptoms with the itching. And that was really causing a sort of a embarrassment and discomfort to him when he is in a public place. And if he develops a sort of an episode of itching, it was a really embarrassing moment for him. He admitted that he developed a sort of an abnormal craving for the sweets, salt, and savory. Sometimes he was taking the chocolate from his child's hand. So that much obsessive craving he developed, and random itching in both the nostrils. He had a history of hay fever since past few years. When season gets changed over here, when autumn goes and spring comes, many patients, they are developing a hay fever with the itchy eyes, running nose, watery eyes, lacrimations, and mild coughing. Okay, very important symptoms he gave me that he visited India, Gujarat, and he had a few mosquito bites and he had a light fever. But not fever with rigors, no bitter taste in mouth, no headaches, nothing like that, no drenching sweat. So I can assume that he haven't had any malarial fever, and simultaneously he had a sort of a blood test in India, but it has not shown any dengue or malarial parasites in it. Okay, now coming to the physical examination, patient was very alert, well-oriented man with a regular pulse, but it was a bit tachycardia, that is 94 per minute. BP was 150 by 82. The respiratory rate was 26 breath per minute. Temperature was 98.8 degree Fahrenheit, and saturation of peripheral oxygen was 92%. That was little low. On examination, neck was supple, no jugular venous distension, and no lymphadenopathy while palpating the neck. Yes, now coming to the cardiac examination, while auscultation, no audible murmur, no rubs or no gallops I found. He had a normal S1, S2 findings. Bilateral equal decreased air entry with apical wheezing. That was very remarkable while examining his chest. His X-ray chest was showing hyperlucent area in bilateral lower lobes. Examining the extremities, especially nails, there was no clubbing. And when there is a no clubbing, at least we can have assurance that patient does not have any asthmatic background. So I have advised further investigations about full blood count, that is FBC, C-reactive protein, and procalcitonin, because patient has taken antibiotics. So I have advised all these three tests. And with my surprise, you can see here that eosinophil was 12.8. Ideally, it should be 0 to 4, but in his case, it was 12.8. So 4 times. And laboratory has also mentioned about eosinophilia. And with that, no doubt his ESR, that is erythrocyte sedimentation rate, was normal, that is 16. But we have to make a note of ESR just to rule out any deep-seated abnormal pathology. WBC, here we can see that 6.8, 6,800 WBC. Eosinophil was 12.8, and absolute eosinophil count was 870. Normally, what we require is 400. Normal eosinophil per cubic millimeter is 0 to 4, but in his case, it was 12.8. So, considering these results, full blood count done in January 2023, showing high eosinophil, suggesting eosinophilia, and lab has also put a remark about the eosinophilia. So, considering all these symptoms, I did repertorization. But before doing my repertorization, we have to consider the miasm. So, miasmatically, patient is soric, dry spasmodic cough with a soric patient. Patient is chilly and hypersensitive to cold, catching cold and hay fever very easily. Expectoration is usually mucus. Scanty expectoration has to strain a lot and taste less phlegm. The phlegm, the sputum, was tasteless. Sometime in our repertoire, you find that sputum is salty, sputum is sweet, but in his case, the phlegm was tasteless. Burning and itching in eyes, constant desire to rub during hay fever, and watery discharge from nose and eyes, especially when he gets exposed to the open air. Okay, so now looking to the repertorization, I took 31 symptoms. Respiration difficult while ascending stair, respiration difficult from dust. Why from the dust? Because patient is working. Still, this patient is working in a bakery. And bakery, when they were doing a cleaning process at that time, the small fragments is flying in the air, and he was inhaling, and it was getting worse and worse. So respiration difficult during daytime, respiration difficult at night, in bed. So all these symptoms I have taken with the repertorization. Let us go to the next slide. Respiration, panting while stooping. When he tried to bend to pick something from the floor, he was feeling like that, as if he's sighing. But it was in repertory, we find these symptoms as a panting. Considering the chronic obstructive pulmonary disorder, if patient is developing a panting, then we have taken this rubric as well, that's chronic obstructive pulmonary disorder, though it was not, because it was a short-term origin. So all these symptoms we had taken, and ultimately we found carcinosin after repertorization. But my conscience was not permitting me to go with the repertory and to prescribe him carcinosin, because as earlier mentioned, listen to the whisper of your heart, and my heart was not allowing me to prescribe him carcinosin. So then I switched over my thought patterns and my clinical skill on other way, on clinical aspect. So here I will ask to all my colleagues that, do you have any idea what it could be? What is your opinion? Any suggestion? If you can write in a chat box, it would be a great pleasure for me. Anyone? Yes. I want to know the diagnosis. Anybody? Okay. Let me end the curiosity over here. It was a Loeffler syndrome. And that's why repertory was not telling this thing to me. My analysis was not telling this thing to me. And now, what is Loeffler syndrome? Because I studied Loeffler syndrome. And that's why the carcinosin is not the medicine for the Loeffler syndrome. The calcarea Rs in chat box, that's not the medicine for the Loeffler syndrome. As per my protocol, considering the patient as a whole, we always consider patient as a whole. And with its symptomatology and the clinical picture that patient was presenting, I came to conclusion as a Loeffler syndrome is a condition where eosinophil accumulates. Accumulation of the eosinophil in the lungs, in the lung tissue, which covers the whole lung tissue, alveoli, and then patient is not able to exchange enough amount of oxygen. So patient is developing a hypoxia. And because it happens due to a response of parasitic infection, that is ascaris, roundworm, strongyloidosis, and dirophilaria. So again, I'm reminding you that preventive and social medicine is very, very important. Patient visited Bharuch. Bharuch is from the Bharuch to Dahanu. That area is classified and declared the filarial zone. A lot of patients of filariasis you will find in that zone. And with the filariasis, there is a high rise of eosinophil in the blood. So in the parasitic infection, ascaris. Secondly, patient having abnormal craving for the sweets. Patient had a severe itching at the back passage. Patient having a tightening feeling in the chest. So all these symptoms are in favor of tropical eosinophilia. And eosinophilia is the main feature of diagnostic criteria for Loeffler syndrome. Wilhelm Loeffler described this syndrome in 1932. And patient was successfully treated. And till today, patient remained symptoms-free. Patient haven't had any episode of asthma. Homeopathic remedies were given with Thuja 1 mg single dose every week for 4 weeks because to remove the bad effect of vaccine. After that, I advise him to take Aurelia mother tincture and Sina mother tincture. 10 drops of Aurelia and 10 drops of Sina mother tincture in a 500 ml of water bottle. Along with natron sulf, 3x, 2 tablet morning and 2 tablet evening for 3 to 4 weeks. And again, I called that patient when we had a short of a clinical meet sitting in clinic. And you can see the eosinophil has came down to 5.7. Previously, it was 12.8. So recent blood result shows the remarkable reduction of eosinophils in blood count. And I have advised this patient that you can show these results to your GP as well. So NHS can make a note that how this patient has responded to the homeopathic treatment. And here you can see the ESR has gone down to 8. And this, the comparison study I have made over here, that on 25th of January, his hemoglobin was 14.4, WBC was 6,800 cells, neutrophil was 14.7, lymphocyte 36.8, monocyte 9, but eosinophil was 12.8. Basophil was 0.7% and ESR was 60 millimeter per 1 hour. And on 1st of August, hemoglobin was 14.6, WBC was 5.97, 5,970 cells, neutrophil was 39.4, lymphocyte was 43.7, monocytes was 10.2, and eosinophils were 5.7 only. So it was very high. Here it is low. Basophil 1.0 and ESR was 8 millimeter per hour. Here, I would like to mention that if I would have gone as per the repertory, then this patient might not have improved. When I went on clinical aspect, comparing the disease picture with the patient's clinical picture, and I got this result. And patient was cured long back, but during that phase, I was in India. While coming back, patient has insisted me that I want to do the blood test again. So we did. Otherwise, patient was symptom-free, and I don't want to unnecessarily advise them to undergo or short of any investigation unless and until it is badly needed. And this is the group of homeopaths. You can see one Dr. Vani. Next to Dr. Vani, there's a Dr. Rajani. So they had a sort of a privilege to attend the sitting in clinic. They were examining the patient. They are the witness that they have seen this patient, and patient has really discussed about his progress. This lady she's head of the maternity ward at Cambridge. She also attended, and she found that no, homeopathy is working. Yes, homeopathy is working. If we go on clinical aspect, if we go on constitutional aspect, if we go on miasmatic aspect, and if you take the detailed history and when you correlate the picture of the patient symptoms along with the clinical picture, and when you select a well-selected remedy, homeopathy will never fail. Patient, when visited me in a month of January, patient was 58 kg, and today patient having a 64 kg weight. So this all about how we can take a U-turn after comparing the disease picture with the clinical picture and with our homeopathic aspect. And for me, happiness always comes when we test our skill towards some meaningful purpose. Hope you have enjoyed my thoughts, where impossible can be possible with the help of homeopathy, where well-selected remedy never fails. Okay, thank you very much. And if you have any questions, please feel free to contact us. If you like my presentation, you can share your thoughts on Google. And if you have any question about any clinical condition, you can email me. I am here to help for the cause of homeopathy to everyone and to everywhere. Thank you. Thank you very much.
Thank you, Doctor. It's a wonderful session. So the intuition and the learning we acquired through the constant effort outsmarts even the repertory. I think even after repertorization, we need to apply our intuition also, our mindfulness also for the selection of the medicine, isn't it? So great, Doctor. And it's a time for the interaction with the speaker. Participants can raise their hand. Dr. Nutan Sharma is here. Doctor, you can ask.
Hello. Hello, sir.
Hello.
Nikunj, sir. Wonderful presentation.
Thank you.
Sir, I just wanted to ask you whether you have attended any patient, asthmatic patient of like acute exacerbation of chronic asthma, like
Yes.
status asthmaticus, any patient in
Yes.
emergency?
Yeah. Dr. Sharma had two hospitals in India. I started my practice in 1980, 24th August 1980. Till 2004, I was in India, and I had two indoor hospitals where I absolutely exclusively using homeopathic remedy. When any patient having an acute exacerbation of asthma, at that time, considering the patient's clinical condition, if we can use the mother tincture sublingually, immediately it subsides. And if you read Boric Materia Medica, and in the arsenic album, you will find that if you put 10 drops of Blata orientalis on the tongue of the patient, means sublingually, followed by arsenic album 1 dose of 1 m potency, asthma will come under control very quickly. And I was using the same protocol here also. When patient comes with acute emergency like severe abdominal pain, severe toothache, severe earache, and severe respiratory distress, we are using the mother tincture sublingually, and that to be followed with the help of potentized remedy, like 1 m power 200, like that.
Okay, wonderful, sir. Thank you so much. One more question.
Yeah,
If
sure.
a patient is coming with IgE, elevated IgE serological test, it is around, normally it is around 140, but if it raised 1200 up to 1200, and there is nothing, only breathlessness. So how we you approach the case?
Dr. Sharma, I'm practicing in Leicester, and our former mayor, she had a high level of IgE, immunoglobulin E, and that unit was 2000. And I treated her very successfully because she was diagnosed with the fibromyalgia. She was feeling weak, tired, and everything. So when you go for IgE, just consider that what condition she having or he having, means patient having. And accordingly, if you give the deep acting constitutional and miasmatic remedy, the patient which I treated, I started with a tuberculinum 1M with frequent repetition of 1 dose every week. And patient responded very well. And then you can use alpha or shot of a selenium like that, just to boost her immune system, just to boost the patient's immune system. But definitely it can come down. You can also keep natrum sulf in your mind. It's a very good medicine. Patient, if you look deep down to this patient is working in a bakery. There is always a shot of a humid atmosphere in the bakery, close atmosphere. Patient has to wear a mask. So patient having a mild hypoxia as well. And natrum sulf is a remedy to overcome all these symptoms. And that's why Dr. Hanuman has used the very particular word, marshy places. Natrum sulf is a medicine for the marshy places. Those who are living near the damp places. Here in UK, majority of the house, they are damp proof, but certain house having a damp. And that's why patients developing asthma. So these are the causative factor. And sometimes that causative factor becomes the obstacles to cure as well. Okay.
Thank you, Doctor. And next is Dr. Hubert De Silva.
Hello, sir.
Yes, sir. How are
Hello,
you?
sir. Very nice presentation and very scientific presentation, evidence-based presentation. Sir, I want to ask you, some cases, very much spasmodic type of dyspnea cannot take, even it is coming very suddenly, but for some time they cannot even, I have failed in such cases. What we can do? Very spasmodic type of dyspnea.
So we have to think about the homeopathic antispasmodic. As I work a lot of years in medicine on allopathic side, so I have labeled this Ferramphos is a homeopathic paracetamol. Colosynth is a homeopathic baralgan. So if we consider the antispasmodic, that is paroxysmal asthmatic attack, and antimony tart is one of the best medicine to break that attacks. Antimony tart. One of my friend, he is a surgeon in India. I used to use his operation theater to open the block fallopian tube with our homeopathic medicine. His son and daughter, they both had a severe croup, severe coughing. They were not able to sleep at night, and that's why they were disturbing the sleep of whole family. And they were treated very nicely with the antimony tart. And that boy has become a radiologist now. So antimony tart is very good to break the paroxysm.
Thank you, sir.
And as I mentioned about earlier, that Bharuch, from Bharuch to Dahanu, it's a filarial band, like in your Kerala. I came across one article. There is one village, Kodini. There is one village in Kerala, Kodini, Kodinhi. Am I pronouncing right, Dr. Dhanesh?
Yes, sir. Kodini.
Kodini, right?
Yes.
Kodini village. You know about the peculiarity of the Kodini village. Everybody having a twins. 400 pairs of twin.
Okay, sir.
That's the that has really drawn the attention from all over the world. Codin is a small village, but all the family having twins. It's sort of a regional research. The same way this Bharuch to Dahanu is a filarial belt. So majority of the patient having a high number of eosinophil in their blood, and that's why they are developing asthma. But it's not an asthma. It is mimicking like asthma, but once we remove the high level of eosinophil from the blood, patient becomes normal. And when there is a no clubbing, means there is no asthma. Yes, sir. Any other question?
And next is Dr. Rajeshwari. Doctor, please unmute.
Wonderful discussion about the low-flow syndrome and the medicines which you have given. Apart from SINA, I wanted to ask you whether you have used about your experience regarding Tucrum, then Felix Mas, and Santoninum, which are also given in the Materia Medica. Do you have an experience regarding those medicines?
Yeah. We are using. See, there was one concept in India long back that if you walk barefoot on the grass, your eye numbers will go. And many people, they have followed that, and they came with a history of helminthiasis because the soil contains worms. The Enterobius vermicularis, they pierce the skin of our feet. They goes into the lymphatics, then it comes into the circulation, then it goes into the lungs, and then patient develops low-flow syndrome. You can use Santonine, you can Felix, you can use this SINA, you can use Spigelia, you can use Sabadilla. These all are homeopathic anti-helminthic.
Yeah, thank you, sir.
And we have used that. We are using, till today we are using.
Yeah, I have also been using that. Santoninum I have frequently used along with SINA also, and it gives good result.
Yes, very good results. Yes.
Absolutely. Will come saying that we are giving albendazole and so many medicines, but they have stopped already taking those and started taking homeopathic medicines. Right,
madam. Right. Absolutely right.
That boosts the confidence of people, you know. There was a time when, you know, people used to be more aware about helminthiasis. But recently, you know, people are not so much. They are towards like, you know, fever, asthma, hai, cough, hai, all these things. But they are neglecting that part where helminthiasis can lead to so many problems. This
here
was a very...
Sorry to interrupt, but here in a school, when any child is found with a helminthiasis, the whole school is being given a shot of a anti-helminthic treatment for all the children, all the students. So it should be implemented in India as well.
Yes. Thank you so much.
Thank you, doctor. Thank you. And next is Dr. Hariharan. I welcome Dr. Hariharan for the vote of thanks as the time is nearing.
I've seen that Dr. Kurup sir wanted to tell something, but hello, sir. Please unmute yourself.
Okay. The doctor was asking that question regarding the helminthiasis. I treated a case that regarding that the child was having cough. Treated with several allopathic hospital and even homeopathy, but it couldn't. But then I asked that to check the motion, then find out that some of the worm infestation, thymol cured completely because your information. Even parasitic information can cause so many other problems also. It can be correctly indicated in pathologically, if you may give also, it will cure. That is my experience. I want to share that one. Thank you. Sir, your session was excellent. Keep it up. Come again with such a wonderful cases.
Thank you, sir. Thank you. He's from my college.
Thank you.
He taught in our college.
Excellent.
So I consider helminthiasis is a real obstacle to the cure. So better to rule it out in our homeopathic practice.
I was teaching pathology in Anand Homeopathic Medical College.
Yes, sir. I know.
Parasitology.
Yes. So I'm calling you as my guru.
Sorry.
Thank you. And next, Dr. Hariharan for the vote of thanks and the comments.
Okay, doctor, your way of prescription is good according to the pathological method, and you got the result also. I will also try in certain cases and find out the results. Sir, in order to reduce the eosinophilia, see, usually the hydrocortyl tincture along with arsenic album, high potency will do good for reduce the eosinophilia. In local area, in Kerala, in certain places, they are having a lot of filariasis cases. In such cases, very easily we can reduce the eosinophilia count.
Okay.
So it is a pathological method. Okay, doctor, your class is very nice. It is highly enriched with knowledge. Thank you very much. On behalf of IFPS and the attendants, I said thanks to you. Come again, doctor.
Thank you. Thank you very much.
Thank you all. And it's the
Thank
time
you to everyone. Thanks.
Thank you all. And it's the time to start the Malayalam session. Over to Dr. Dhanesh.
Thank you, Dr. Vidraj and Nikunj Trivedi, sir. Namaskar. IAPH